You're watching Heart to Heart on ABC 27, brought to you by Penn State Milton S. Hershey Medical Center.
Welcome back. Here's a story about a woman from the State College area who chose to have a surgical procedure done that's more commonly done on patients that are much older. This is routine for 45-year-old Sarah Shoemaker. Right before dawn, she laces her sneakers, stretches, and then Sarah's ready to go on her 6-mile journey.
It's my outlet. It's my time to myself. If you're religious, you may call it my prayer time. It's just my time to myself.
Running sneakers have been a part of Sarah's life for 30 years. She's won hundreds of races, including a marathon in Kansas.
I was really pleased with that. I was a little surprised, although it's not as competitive like you would have as Boston or New York, but I was surprised that I won it. I ran just under 3 hours.
Sarah's love of running almost came to a halt because of severe pain in her right leg.
It was so bad that I would have to stop running. That's how bad the pain was. If I would just walk, it's fine, but if I would try to run hard where I'd really get my heart rate up going, I would have this pain going in my leg, and sometimes my lower leg would feel numb or my foot would feel kind of numb. It got to the point where I thought, well, maybe I should just give up running and try doing something else, type of thing to stay fit.
Her diagnosis is something we call iliac arteriopathy, which is a condition where repetitive movement of the artery causes the artery to actually fibrose and narrow. It's trauma to the artery caused by repetitive motion.
Dr. David Hahn, a vascular surgeon at Penn State Milton S. Hershey Medical Center, says Sarah's condition is often found in cyclists and runners.
And this is the diseased artery on the right. You can see how narrow it gets right here compared to that same artery on the left on this side, which is much more normal in caliber.
After Sarah did extensive research on her condition, she had to decide whether or not to have the surgery.
She decided to have the operation because she didn't want to quit running, and really the only way that she was going to be able to continue doing what she loved to do was to get her artery replaced with a new piece of conduit, a new piece of pipe. We took a piece of Dacron, which is this tube right here, and we sewed it right into the very end of her common iliac artery, which is right here.
A couple of hours in surgery, 4 days in the hospital, and Sarah was home, resting and relaxing until...
After my 6-week follow-up, he says, "You're good, you can start running," So I came home that afternoon, and I would try to go for a run, and it was like, oh man, I'm so out of shape.
Sarah gradually got back into shape.
The real test was once I could run 5 or 6 miles and start running hard, was I going to have that pain? And I didn't, and it was just that was when it really hit home. Yeah, it was successful.
Sarah had the surgery more than a year ago. Now she runs on average 35 to 40 miles a week, and she says she has no pain. Chuck?
Deborah, I'm impressed by that 35 to 40 miles a week. That's amazing. But joining us now is a vascular surgeon, Dr. Amy Reed. What are the most common vascular problems that women experience on your experience?
Well, normally what we would see is more of a peripheral artery disease or blockages of the arteries which give blood flow to the legs. Some of the other areas women have issues with are veins, varicose veins, as well as plaque buildup in the arteries that give blood flow to the brain. And rarely we can see problems with aneurysms which will develop in the belly or in the abdomen.
Now, that type of surgery we saw there with Sarah, is that common?
It's not common for that type of problem. Typically these days, when we're dealing with plaque buildup in the arteries, many times what we can do is use balloons or stents through a little needle puncture and not have to go to a bigger open operation.
Now, to me, to a layperson, when I see blood vessels replaced, that sounds like a very difficult and a very dangerous procedure. Is that a misconception?
Well, it is a time-consuming and attention to a lot of detail has to be paid during the surgery. But I think one of the things as vascular surgeons is keeping abreast with the new technology, and many of these things are ones that we can do with balloons or stents as outpatients. And so really I think the thing for particularly women is to recognize that there may be some problems with the underlying vessels and to seek treatment for that.
It's amazing. All right, let's check in quickly now with Deborah in the call center. Deborah?
Chuck, we have time for one last viewer question, and here it is. I believe I have signs of peripheral artery disease, such as numbness in my legs and poor blood circulation. Can exercise help reverse or control the disease?
Well, certainly exercise can be part of the therapy for peripheral artery disease, but when you talk about having symptoms of numbness, this could also be a nerve problem. So you need to see your doctor about getting the correct diagnosis.
Okay.